Welcome back to the Move Better Project. Today we're going to go through some lower body isometric or near isometric exercises that are designed to be a minimum effective dose of exercise for various joints and tissues of the lower body. These can be great things for people who are in pain, acute or chronic, to get into a position that you can tolerate, get a muscle contraction, get blood flow into the muscle, remind your nervous system that it's okay to contract certain muscles without pain, without aggravating symptom. I'm going to start in this hook lying position. For most people, it's going to be most comfortable if you press your lower back into the ground a little bit, so going from here to there. I can accomplish that by contracting my lower abdominals and my glutes a little bit. If that is not comfortable for you, by all means, choose a position that works for you. This position is going to work for most people, and it also is going to allow you to properly contract your hip flexor for this exercise. This position here will work for some people. This will work for others. If you can, past 90 degrees of hip flexion, if you can tolerate that position, that tends to be best for getting the inner hip flexors, as I call them, iliacus and psoas major, that attach onto this medial part of the femur here, the lesser trochanter. If I can get above 90 degrees, those muscles have a much more effective pull. However, you may find that it's not possible or not comfortable in that position. You may find that that muscle cramps very quickly, but that's ideally where we want to get a contraction to start. General guidelines on these are you're going to do 1 to 3 repetitions of holding until you feel fatigue in the muscle. Should not be painful, should not be aggravating, should just be enough to get a little bit. And right there, I'm starting to feel like, okay, that may cramp or may get really angry if I keep going. So I'm just going to slowly lower down and then take a rest. I repeat on the other side. Come up here. For me, past 90 is ideal. Again, choose anywhere in here that works for you to get that inner hip flexor active. Hold until you feel the onset of fatigue in there, and then slowly lower down. This side lying position is where I'm going to be for my clamshell exercise. Normally we do these through a full range of motion, or at least a partial range of motion, but for today we're going to focus again on this minimum effective dose. And all I'm going to do is start in this position. I've got a yoga block. This could be a pillow between my knees, anything to give a little bit of space. It's going to make it easier for your gluteus medius to do the activity here. The gluteus medius is the muscle behind the hip joint. So if I find my femur here, I go behind. That's where I want to feel effort as I lift up and hold. If you feel the muscle in front, tensor fasciae lata kicking in, try as best you can to visualize the muscle from behind pulling the femur open, and you can feel with your fingers getting that contraction versus the muscle in the front, TFL. For today's effort, all I want to do is just lift up about an inch or a centimeter, whether you're metric or standard system, no discrimination there, and then hold. And I'm going to hold until I feel the onset of fatigue in that gluteus medius muscle. If you are a little stronger or this is too easy for you, you can also, in the same position, it's a little bit hard to set up, but wrap a resistance band around your knees, and then you're prevented from going across if that position is painful for you, but it allows you to get a little stronger contraction. But again, I'm just barely lifting up, and I want to wait until I feel the onset of fatigue. Now that gluteus medius for me is starting to get warm, starting to get a little bit of fatigue. That's all I'm going to do. And again, I'm going to go for 1 to 3 repetitions, and that whole thing was 1 repetition on each side, each repetition just going to the very onset of muscle fatigue. Number 3, I'm going to be back in this hook lying position, and I've got the yoga block this time just between my knees. And all I want to do to contract the adductor muscles, the groin muscles, I'm just going to simply squeeze the block and hold. And I can squeeze as strong as I'm comfortable with. It should be no pain. It should feel like a good effort of contraction in between your knees in this inner thigh or groin area. I'm just going to hold that until I feel fatigue. And again, I don't want to be doing this in this broken anterior pelvic tilt situation. That's going to be very hard to get a good contraction. I want to be in a neutral position, belly button pulled in, abs engaged, pelvic floor contracted, and then with that type of setup, then I can squeeze my knees together. If you are more comfortable in a knees extended, hips extended position, that is totally fine. That will be more challenging, but hook lying is fine. This is, again, kind of lowest level, minimum effective dose until you feel fatigue. I'm now going to focus on getting a contraction in my glutes. To do so, I want to press my feet, or my heels especially, firmly down into the ground, and imagine that I'm about to lift up, but not quite do it. I want to produce all the force I need to lift up into a bridge, but I'm not going to actually lift up. I just want to get that isometric contraction. Now, if I can tolerate flexion of the lumbar spine, if I'm not in any kind of severe pain from an instability or disc injury, then I can actually do a posterior pelvic tilt and try to tuck my tailbone underneath, get a really strong contraction in the glutes, and then keep coming up, and I can do my isometric anywhere along the range of a glute bridge if that's tolerated for you. But again, lowest level, just down here, is totally fine. Belly's tight, pelvic floor contracted, pushing my heels into the ground, feeling my glutes contract, get warm. My butt muscles should be firm and contracted. I should have little buns of steel doing this. And again, I'm going to go until I get the onset of fatigue. Your glutes are bigger, stronger muscles. It may take a long time. It may take 30 seconds, 40 seconds to get a little bit of fatigue in there. That's fine. Again, we're trying to get effort, warmth, contraction, nervous system activity, all of those things. Make sure your body feels okay, doesn't feel pain, and that's it. Okay, I'm back in hook lying, and now I'm going to get my quadriceps, my anterior thigh muscles engaged. To do so, I can do a straight leg raise or even just a straight leg hold here. One knee is going to stay bent, the other knee is going to be extended. Again, I want to engage my abdominals here, and I'm going to try to extend my knee powerfully and hold that contraction, and I don't even have to lift up. If I want to lift up 1 inch, that can be an even more challenging position, but wherever you're at, I want you to make sure you're powerfully engaging your quads, keeping the knee extended. Lift up if you want to. Again, hold until I feel the onset of fatigue, and then lower down. For the hamstrings, we want to be in the same position, but now I'm simply going to dig my heel into the ground, and I'm going to try to pull back this way. You can do a very similar exercise in standing. I'll show you how to do that in a second, but if you're a person who's in chronic pain, say, is more comfortable laying down, has a difficult time spending a lot of time standing, this is a totally good option as well. But I'm just trying to dig my heel into the ground, trying to flex my knee and extend my hip a little bit. Again, 1 to 3 repetitions until the onset of fatigue. If you can tolerate standing, here's how we're going to hit the hamstring. I'm going to stand on one leg. You're welcome to put your hands on something for support, and I want to simply flex the knee. I don't want to lift the knee out in front like this. I just want to flex my knee a little bit and hold in that position. About 90 degrees of knee flexion should be good. I want to feel effort and contraction in my hamstring. If it starts to feel fatigued or like it's going to cramp, just slowly lower down. That would be around 1 repetition. So there you have it. Isometric or very low level exercises for all the muscles from the hips all the way down to the knees. Great for if you're in chronic pain, acute pain, gives you something to do when you can't do very much. Give them a try. Leave a comment below. Let me know how this goes. Make sure you're subscribed to the channel, and I'll see you next time.